Hi everyone, welcome to this video. I'm going to walk through how I do formal ward risk assessments, but you can use it for many things. This is a basic weighted formal risk assessment that I use on my ward walkarounds. I've just chosen a few variables, but you can add more if you want, but the premise is the same. You can find this spreadsheet and a Word document explaining the video in the video description. If you like the video, please like and subscribe. Okay, so the first thing I'll do is go through the spreadsheet that I keep, and this is my documented evidence of doing my management, health and safety formal risk assessments and manual handling operation regulations. So each variable I've put there that I consider a risk, I then attach a weight. 1 is everything's okay, 2 is medium risk, and 3 is high. As you can see, when you put 0, you add it up and it tells you it's a low risk. If I were to put 2s in there, medium risk, it will add it all up and tell you it's a moderate risk. If I were to put 3s everywhere, add them up, it's going to tell me it's a high risk. And then this is a really good way for each ward to come up with interventions. So for example, I did this on the ward last month, and this was my total here, 28. It came out high. So I did some interventions. I asked the manager to clean the ward up. They've done that, so it's a much cleaner ward now, but there's still a few hazards around. Nobody was using their Rtotal dynamic risk assessment before doing a patient handling maneuver, so obviously that scored high. It's a lot better now. Staff are pausing and thinking about risks, and if they find a risk, they stop and they're escalating it to their superior or senior staff now, so that's great. When I went there last time, the hoist was out of date. I've had it serviced, so the risk is reduced there. Training compliance wasn't great, but it's much better now. The ward safety checks still aren't great, but I'm working with the manager for that. The skill mix was bad. It was all new staff who clearly hadn't done their induction training yet. But the skill mix much better when I revisited, so I'll put a 1 there. Observation plan is workable, yes. Escalation pathways are clear, so all staff know who to escalate to and how to do it. All staff know how to report incidents and are reporting incidents, and I checked and there haven't been any major incidents since I was last there. So the review triggers are set and used, so I'll put 1. And we can see now that the Rtotal, the total of the risks on this weighted risk assessment, is 14. So if we do a quick calculation here and we put 14 divided by 28, which was the old risk, and then here we just times that by 100, we can see that the risk has dropped about 50%. This is a relative risk because we're using a weighted risk assessment. It might be when you leave the ward, something happens. So this is just a guide for you, to guide you and to see how your interventions are doing. It's also can be used for a legal documented formal risk assessment of the ward for manual handling. So if you have any questions, please ask me. I'll include my email in the video description along with the download link for the Excel spreadsheet and the Word document. Thanks for watching. This is the basic formal risk assessment. I'll be making some more videos going from basic, this one, to advanced. But this is a very useful tool to measure how you're doing. So thanks for watching.